Good afternoon, it's Dr. Larson talking about our situation with COVID-19 in Kittitas County. So we continue to have outbreaks in 2 long-term care facilities. We have an outbreak in 1 food service business in town, and we also have a current potential outbreak in an agricultural facility. Our current case rate per 100,000 is 262 per 100,000 per 14 days. So the way to think about that is for Kittitas County, that would be 130 new cases over the last 2 weeks. And that's about where we're at. We have, as of this morning, we have 118 active cases that we're following. Each one of those has about between 4 and 22 contacts, and those people are all being contacted every day. So we have a total of 10 deaths from COVID-19. Those are people at the Prestige and at Pacifica who have underlying health problems, but COVID-19 has really pushed them over the edge. So it's not that COVID-19 is the only cause of their deaths, but it's a situation where these are people who are compromised and they really just can't handle having COVID-19. So we have about a 23% case positive rate. So that is out of all the tests that we're doing, 23% of them are positive, and we're only testing about 4 people for every positive, and we should be testing more than 50. So we're not really testing enough. We're not really testing enough cases, enough people. We have the ability to test anyone with symptoms, and we have people who can test. We can test anyone who's a close contact, but we're probably not testing enough. So I want to divide school openings with the limitations of groups less than 10. So they are separate, but not truly unrelated. So when our numbers started going up, and when we had to do something to try to change that curve, we first made a decision to close Irene Reinhardt Park, and then we made a decision to cut all groups, any groups except for those related to church, because that kind of falls under a different category from the governor's office. No groups of people greater than 10. So that takes youth sports out, unfortunately, unless you're playing 5-on-5 soccer. That takes baseball out. That takes weddings out. That takes funerals out. Unless you are going to have a funeral or a wedding in a church, those the governor has some guidance for those, but we're stricter than the governor on those groups. And the reason is that if we can get our numbers coming down, we will start letting some of those things happen again. Probably the first thing that'll happen will be the ability to have youth sports again. They had good safety plans in place. It's just we had to make a cut and say everybody has to stop doing what they're doing, because the whole reason that we have outbreaks in the nursing facilities is that we all got lax, we all let our guard down, and we got exposed to somebody at our aunt's birthday party and brought that back into the long-term care facilities and the nursing homes. So that limitation of less than 10 does not apply to schools. It will not be in place when school starts in the fall, and we will slowly start lifting those restrictions as our numbers go down. They don't have to go back down to less than 25 per 100,000 per 2 weeks, but they need to go down from the almost 300, which was where we are currently. So that's kind of where we're at. I'm going to answer a few questions, and I'm going to talk about schools. So some of the questions talk about whether people are wearing masks, asks about classes at Central in the fall, talk about social distancing, talk about a benchmark for people returning to school, and talks a lot of questions about the 10. So I guess, again, masking is required. The masking works to prevent spread. The governor's guidance on masking is there. The guidance on groups of less than 10, we can be more strict than the governor. We can't be less strict than the governor or the Department of Health. So we are more strict in our county because our numbers are uncontrollable. And it's not just at the nursing home. All of those people that brought that into the nursing home, they're living in our community. They're interacting in our community, and we have community spread in restaurants. We have it in bars. We have it associated with barbecues. We have it associated with get-togethers. We have it associated with people who are recreating at the lake. So we cut that down. I am sorry that we have to do that, but this is up to you all to be responsible and try to bring our numbers down, because we can't bring those numbers down ourselves here at Public Health. It's up to you, and it's up to you to protect those people in nursing homes and long-term care, and also to protect the people that are at the hospital that are going to take care of you when you get COVID-19. So if you have an event in September, one was about a wedding, if you have an event, the governor's guidelines still let you have an event in the church. I can't guarantee you're going to be able to have an event in our community. I can't guarantee you anything going forward other than we are continuing to work hard to do our part to stop spread of COVID-19, and you need to do your part. My recommendation would be, don't have any events this summer. Don't have any get-togethers this summer. Stay home. Help us decrease this incident rate that we have, so we can do things like opening schools. So that's a nice segue into schools. So there's a lot of confusion about school openings, and I apologize for that. There's a disconnect between OSPI's guidance and the CDC guidance. All of that guidance, and I was just on a phone call with the state health officers, the state health officer and all the state health officers across the state are talking about school guidance. OSPI is basically saying, we think schools should be open. They're not giving any specific guidance as to whether or not that should be online, a split school, or all in person. They are putting that down to the locals to make a decision. That's the local school superintendents with help from us. And some of that's based upon the amount of disease that's happening in the community. So the amount of disease that's happening in the community is up to you as the community. So if you're really interested in having school in the fall, and I'm very interested in having school in the fall, I think it's important to get kids back to school. You need to do your part, and the part you need to do is to stay at home, not have these gatherings, and help us bring this down. We don't need to get down to a magic number. That number that's been put out there by some people is less than 6% incident rate. We had a big discussion, it was about half an hour discussion, talking about what the metrics are for opening schools and closing schools. We don't really know yet. There will be some metrics involved in that, some numbers, but we don't know what they are. But we need to be coming down. So we need to come down from that 23% down to something reasonable to say, okay, it's going to be safe enough to open schools. And that safety to open schools is not just for the kids, it's safety for the staff, it's safety for the teachers, it's all of those people, the parents, the kids, the staff, the teachers, they all have an input into that. And we can say from a public health perspective, it appears to be a safe number, but that may not be enough to make those groups say, we want to come back to school. I think that's what you're seeing in the King County, the Seattle area school districts, and I think you're going to see a lot of school districts that say, we can't see how we can do in-person school. I think we have some good plans. Central has a plan in regards to opening school. It's probably as good as I've seen anywhere, but I don't know what their board of trustees is going to make a decision today as regards to opening school in person. WSU chose to not have in-person college this year for the fall, so we don't really know, but it doesn't really have anything to do with it less than 10, and it doesn't really have anything to do with the specific number that we have. It has to do with how much you as a community are willing to do to bring our overall incident rates down, to keep that disease out of our community so we can keep it. What's happening in our long-term care and nursing home is exactly what's going to happen in the schools unless we as a community are willing to work on it. So my ask for the weekend is to think about those people in long-term care, in the nursing homes, think about those staff that are working at those places, and think about what you can do to help them. By doing that and following through with that, you're going to have figured out how we can get schools open in the fall. So think about that this weekend, and we'll talk about it again Monday. I hope our numbers are starting to go down. Thanks a lot, and have a good weekend. Thanks. Be safe.